Well, Singapore is developing Asia's first allergic rhinitis database. The condition, commonly known as hay fever, is triggered by allergens such as dust, pollen and pet dander. Now, Project ENTenna will be led by ENTenna General Hospital with the support of several other hospitals and the Agency for Science, Technology and Research, or A*STAR. Allergic rhinitis is a condition that affects 39% of Singaporeans. Symptoms might be similar to that of a common cold, but unlike the cold, allergic rhinitis symptoms typically happen suddenly and can also end abruptly. The mucus produced will be clear instead of a greenish or yellowish coloration. Project ENTenna is already tracking up to 6,000 patients to help guide clinical decisions and chart how Asian allergies are different from Caucasian allergies. Now, we want to find out more, of course, and we have the Principal Investigator, Adjunct Associate Professor Ng Chew Lip, Senior Consultant at ENTenna General Hospital, and Ryan Lim. He is a student who suffers from allergic rhinitis. Thank you both so much for coming in today. First to you, Prof. Ng. I'd like to know why the need to create this Asia First database, and how are you collecting the data for it?
Thanks, Joe. Internationally, there is a shortage of good quality long-term data for this very prevalent condition, especially in Singapore. And most data currently comes from Europe and America. So there is an urgent need for Asia to have our own data to understand our own population. So we're collecting this data at an intensity that I think is not widely seen in other parts of the world. On a weekly basis, we're collecting data from patients, how their symptoms are, compliance data. We're going to compile this together with clinical data, like from electronic medical records, from laboratory tests, and we are going to do biomolecular studies on selected subgroups of patients. So this will all contribute into a large-scale, robust database that will continuously grow. And now with 3 healthcare clusters in Singapore all coming together to contribute data, we are hopeful that it will shed some light on this condition.
Well, it sounds like you have a lot of power behind this project with the 3 bodies there. But, the Asia-specific data is important, as you told us. But what is the prevalence of sinus or hay fever, whatever you'd like to call it? Tell us about our local Asia environment or the genetics that might be different from other parts of the world.
Right. It is very prevalent in Singapore, and in cities like Singapore, there is something known as hygiene hypothesis, where it's more common in places, in cities, especially clean cities.
Right.
And we know that, genetically there are differences between Caucasians and Asians. And as a result of that, our immune response to allergens differ. And the immune pathways that follow after our cells are exposed to allergens would differ as well. As a result of that, we know that some drugs work better for Caucasians and not so good for Asians, and vice versa. So therefore, but now most drugs are actually developed in the West. So I think there is a need to develop personalized Asian-targeted therapies in this very prevalent disease. And the first step to doing that is really profiling and understanding our patients, our population better.
Overdue, if you ask me, to personalize it. And who knew there was a downside to being too clean, huh? So, Ryan, I want to bring you into this conversation because, you are the one that actually has to live with this on a day-to-day basis. When did you first realize that you had allergic rhinitis, and how did that condition manifest day-to-day in your life?
Yeah, so I knew about my condition maybe like a year ago, but this condition has existed throughout my entire life as well. Only other further research, I understood that I actually had allergic rhinitis, which led me to want to seek further treatment. So for the day-to-day life, right, it can come across like blocked nose, runny nose, and most of the time, since I had a deviated septum, only half of my nostril was able to breathe. So imagine only having 50% of your lung capacity being able to be used. I think it can be quite difficult for everyone.
Very difficult. Does it make sports difficult or
definitely.
Yeah. Listening to those stories, it's so important, Dr. Ng, that we use this database to help doctors tailor treatment or even predict allergic flare-ups, if possible, for patients like Ryan. Is that what the next step is?
That's right. So currently, because of the AI component in the database, we are able to, because of the robust data that's coming in, we can predict what the patient is going to happen, what's going to happen to the patient over the next 3 months. So when a patient comes in to see us, we can predict what the patient will react, how they will react, and what will happen to the patient over the next 3 months because of all the data that's coming in. And we compare patients to other patients with similar demographics, similar compliance to medications, and similar biomolecular profile. So that's the whole idea. And with a growing database, the prediction will get more and more accurate.
And you communicate this to the patient?
That's right. So because of that, so in the past when patient comes in, we will ask, oh, how's your nose? Oh, sometimes it's good, sometimes it's bad. You know, do you use your medicine? Sometimes I use it, sometimes I don't. But now we have granular data on, symptom trends of the patient, how they're doing. And at the same time, how compliant they are to medications.
Right.
The chatbot would also prompt patients when they are not as compliant to medications.
So it's a chatbot?
It is.
It is. And what, you get a message?
Yeah.
How does it work?
So we get a weekly and monthly message. So it will contain a Form SG link. So I'll just click on the link and then they'll ask me 2 simple questions regarding my symptom score and asking me how many times did I miss my medication this week.
Right.
Yeah.
And has it been working for you? I mean, does it keep you disciplined about it? How do you feel communicating with this,
Yeah, I think it's a good thing. By asking a simple question like how severe are your symptoms, let's say it's like really bad, it prompts me to really want to seek further treatment, and asking me like how many times I miss my medication this week reminds me to be more compliant to my medicine and makes me more aware of my condition as well. Yeah.
Okay, that's great. And WhatsApp is, of course, the choice of the generation in terms of communicating socially, right? So I'm asking, also curious about the potential to expand what you're doing now for allergic rhinitis to other diseases and even beyond the shores, becoming maybe a regional resource here in Singapore.
That's right. So we built this platform to be replicable and scalable for other chronic diseases as well. We're testing it out and on a condition that is relatively safe, allergic rhinitis. We will expand it to asthma, which is the next airway disease, very important, very prevalent as well. And there are plans to expand it to dementia, stroke, and other chronic diseases as well. And because Singapore is well resourced to do this, we are digital, we are connected, our technology is pretty good, but we are small. Right, so even with 6,000 patients, I think we can do better. And therefore, we are working with regional partners in Southeast Asia and even south of China to contribute data to this database so that we can then have a better profile of the whole Asian population and therefore benefit more people.
Okay, we really appreciate the two of you coming in today and telling everyone out there about what you're doing in this space. Thank you so much.
Thank you. Thank you.
All right, I've been speaking there with Adjunct Associate Professor Ng Chew Lip from the Ng Teng Fong General Hospital and Ryan Lim, who is a patient with allergic rhinitis.